Bismillah ar-Rahman ar-Rahim. Assalamun alaikum. So Abbas uncle, when he invited me for the program to come and MC and just help around, he told me the program was for our community seniors. But I'm looking here and everyone looks very young. So Abbas uncle, this is not seniors program. Huh? Especially, yes, definitely. Alhamdulillah. So inshallah, before we begin, we'll start with recitation of the Holy Quran by Sayyid Uncle Taqi. Let's welcome him with a loud salawat.
اللهم صل على محمد وآل محمد وعجل فرجه. بسم الله الرحمن الرحيم. بسم الله الرحمن الرحيم. ألف لام ميم. ذلك الكتاب لا ريب فيه هدى للمتقين الذين يؤمنون بالغيب ويقيمون الصلاة ومما رزقناهم ينفقون والذين يؤمنون بما أنزل إليك وما أنزل من قبلك وبالآخرة هم يوقنون أولئك على هدى من ربهم وأولئك هم المفلحون. صدق الله العلي العظيم. Bismillahir Rahmanir Rahim. In the name of Allah, the entirely merciful, the especially merciful. Alif Lam Mim. ذلك الكتاب لا ريب فيه هدى للمتقين. This is the book about which there is no doubt, a guidance for those mankind of Allah. الذين يؤمنون بالغيب ويقيمون الصلاة ومما رزقناهم ينفقون. Who believe in unseen, establish prayer and spend out of what we have provided for them. والذين يؤمنون بما أنزل إليك وما أنزل من قبلك وبالآخرة هم يوقنون. And who believe in what has been revealed to you, O Muhammad, and what was revealed before you, and of the hereafter they are certain in faith. أولئك على هدى من ربهم وأولئك هم المفلحون. Those are upright guidance from their Lord, and it is those who are successful. صدق الله العلي العظيم.
Thank you so much, Sayyid. Before we continue, I just wanted to say that I was having a chat right now with Sayyid, and I've met him so many times, and this might be the case for so many of us, and I just found out he was a pilot. And for me, that's such interesting news because it's someone I cross paths with every day. So the reason I'm saying this is that we as youth have a lot to learn from you as youth, you as seniors. So please do interact with us more, and inshallah we'll try do the same so we can learn from each other. So before I continue, I just wanted to quickly highlight one of the rights that Imam Zain al-Abidin alayhi salam said in Muhammad wa ali Muhammad in Risalat al-Huquq, where he says that, and the right of him or her who is older than you is that you should respect him because of his age, not only his age, but his honor and his submission to Allah subhanahu wa ta'ala. And that has precedence over you in Islam. With that, and without no further ado, I would like to invite the specialist for today, a senior consultant physiotherapist who was telling me he worked with various athletes around the world, worked with Deccan Chargers, a team in the IPL, in cricket, which is very exciting for me to hear, and a specialist in sports medicine and sports injuries, Dr. Santhosh Kumar. Let's welcome him with a loud round of applause. And a loud salawat.
Good afternoon, everyone. It's an honor to be here today. Thanks for your time. Okay. Thanks for inviting me, SAAJ community today. Thank you so much. The PowerPoint. Okay. So, first of all, myself, I'm Dr. Santhosh. I have done my master's in sports medicine. I have done my bachelor's. Let me first start from where I am. I am from India. One of the beautiful city, Hyderabad. So yeah, Hyderabad. So I have done my bachelor's and master's all from there only. So I have a quite good experience. I worked with one of the biggest corporate hospitals in India. So later on, I have started my career in Kenya since last 8 years. I worked with the various athletes, and I have treated various type of patients in Kenya. So later on, I have started my own center, that is Bionex, which is a completely advanced and well-equipped rehabilitation and physiotherapy clinic. Okay. So I don't want to waste time of yours, so let me go straight away to the point. So what is, first of all, advanced physiotherapy? What does it mean? So revolutionary technologies transforming rehabilitation and recovery through the precision, innovation and evidence-based therapeutic interventions. So that is what advanced rehabilitation. So what we have right now in our clinic also, how I am practicing. So that is what I am going to explain you today. This is actually, we call it as a R-gate. So this is for the completely stroke rehabilitation, which is very recent therapy. Okay, which is very recent technology right now in physiotherapy, which is completely, patient is both lower limbs were paralyzed, both upper limbs were paralyzed, which means 2 legs were not working, 2 hands were not working. Still, we can make them stand, still we can make them walk. Until and unless patient is on bed, you are doing some exercise on bed, which will never help the patient. The day patient is standing with the machinery support, venous return, we called it, we have a two blade, one is a good blade, one is a bad blade. So bad blade, we called it as a venous blade. So until and unless we are not standing, the venous return will not go up. So venous return is good, then the patient performs well. So that is what this. So patient is completely paralyzed. Even comatized patient also we can make him stand. So that is what this machine does, which we have right now in our clinic and which we are practicing in our clinic right now. And this is also one of the new technology right now we were using. This is a completely virtual reality. Virtual reality placing a major role right now in a physiotherapy and sports medicine. As you said, you are also does your sports in physiotherapy. So this is what a virtual reality posture. These machines right now we were using, currently practicing, that will scan your whole posture. That will give you a printed report. Do you have any forward neck postures? Do you have any lumbar lordosis? Do you have any short limb? Do you have any pelvic tilt? Are you keeping, somebody will come with the heel pains like a calcaneal spurs. Are you keeping more weight on the right foot? Are you keeping more weight on the left foot? That will give you a completely printed report what to be corrected in your posture. It doesn't mean something you have a pain in your body, then only you do posture correction. If you don't have any pain also, you can do a posture analysis to control your future complications. So this is what it is. So good posture will control all your future complications. So this is what a postural analyzer, we called it as a vital PT. And not only that, this will also suggest you, like a future is like a kids, you take sir, you ask them to do exercises, they will never do. Even the geriatric, very old patients, you ask them to do exercises, they will not do. But these come up with some interesting game zone, like that posture analyzer will suggest you, if you play, what is your problem, which game if you play, that particular part will heal. Until that it will helps you. So that is what vital PT, which we are currently practicing also in our clinic. And this is a high intensity laser, which is a class 4 laser, which we are using already. This will stimulate the cellular process completely. For example, who has a pain in the pelvic region, who has a very big glute muscles, this laser can go deeper into the tissue. It has a very deeper penetration. It can go very deeper into the tissue. It can helps to increase the circulation of the particular part, to increase the circulation to reduce the pain. This is what it is, which is a class 4 laser. This is also a robotic laser completely. So whichever the part needs a treatment, you just enter the problem, the diagnosis, everything, the remaining part, the laser will take care, the robotic laser will take care of everything. That is also currently we were practicing. And this is also one of the new technology in physiotherapy right now we were practicing. This is shock wave therapy, sir. Right now we were using shock wave therapies also in our clinics in physiotherapy. This is the breakdown of calcifications. This mainly we use it in a chronic pains. See, somebody will visit so many doctors. Since 1 year they have a pain, since 2 years they have a pain, since 3 years they have a pain. Still they are suffering with the pain. Okay, first let me tell you what is chronic and what is acute. Acute pain means pain is two types. One is an acute pain, one is a chronic pain. Acute pain means who has a pain since only 1 month, 2 months or less than 3 months, we consider as a acute pains. Those type of pains, we treat it only 2 to 3 sessions, they will be fine. But chronic pains needs a particular rehabilitation. This is for that. So chronic patients have a calcification of muscle, calcification of bones. So we have to break down the calcification, then only the pain will go off. Otherwise, they will never go out of the pain. They'll suffer for that. So that is the main reason we have to break down the calcification to relieve the pain. This is what the machine we are using for the chronic pain therapy, sir. And now this one is also an interesting combination therapy machines. This is combination therapy. Right now we were practicing. It has a different types of techniques. One is iontophoresis techniques. One is a ponophoresis techniques. See, for example, athletes. I am practicing lot of athletes. I am treating lot of athletes. You cannot give them any oral painkillers. Not only for an athletes, even for senior citizens who has a kidney disorders, who has a liver problems, who has a stomach ulcers, who has a heartburns. If you give them painkillers, next day, the same day night, they will not sleep because of ulcers, gastritis and all. So, but these, I'll give you a small example who has some tennis elbow. So, you don't give oral painkiller directly. So, you use some ultrasonic gel with a small painkiller gel here, and with the machine heads, that particular area we can insert the painkiller ions to the muscle directly, so that the other body is okay. Only the painkiller ion we are inserting here only, the patient will be fine. So there is no secondary complications with the medicines or no complications of oral painkillers and all. So that is what it is. That ponophoresis, iontophoresis techniques also we were using currently. Now this is also one of the interesting machine which helps in senior citizens, not only senior citizens, for everyone we were using, sir. This one is a biofeedback nerve stimulator machines. It helps to treat the completely nerve systems and muscle controls. For example, you can see once you cross 60, 65 or 70, you cannot control your urine, sir. So for example, you are able to control your urine also, it will fall like a drops. Even for women also, after 3 deliveries, after 4 deliveries, when they are coughing, if they do this way also, urine leaks. So nothing to worry. We have a female physios also who is trained in this. Okay, so that with the particular machinery we use, and we stimulate the particular nerves, we stimulate the particular muscles to control the urinary issues also. So this is the biofeedback machines. Currently we are also practicing in our clinics. And this is a completely robotic spinal decompression machine. So this one, this is a completely target therapy, sir. Before you go to physiotherapist, you used to tell them, I have a neck pain, I have a thoracic pain, I have a lumbar pain. Now it's not like that. This is a completely targeted therapy. Who you have a problem in C3, it will decompress only C3. You have a L4 problem, it will decompress only L4. The remaining part, the machine will not even touch. You have a T11 problem, that will decompress only T11. For example, somebody has a lower back pain which is radiating down to the left leg, completely that will distract, and that will also decompress the problems. So which is a very recent technology. Currently we were practicing 90% of spine surgeries and chronic pain who is suffering since last 2 to 3 years also, we can give a treatment with using robotic decompression machines. Currently this is also we are practicing in our clinics. And the decompression not only for the pain. If you see any small kids below 18 age with the scoliosis, kyphosis, lordosis, they born with the spine deformities. We called it as a scoliosis, kyphosis, lordosis. So those problems also before surgery, without surgery, if they are under 18, because once you cross 18, bones has already formed. So we cannot correct. But if they are under 18, we can also correct without surgery all scoliosis, kyphosis, lordosis related spinal issues also, sir. Any spinal deformities also. Yeah, this is also same active passive trainers who is completely unable to walk. His hands are not working. It's like this is also same like a rehabilitation technology machines. They looks like a gym, but they are not completely gym like a material. They made for the patients. So we can tie the patient hands and we can tie the patient's legs to the machine. Once you switch it on, that itself will encourage exercise in the hands and legs. This is purely for the old age rehabilitation. And this is also same, sir. This is also for the magnetic shoulder therapy. These are all also currently we were practicing for a PA shoulder. They are the who has a sugars, who is suffering with the diabetes. You can see they cannot lift their hands more than above shoulder levels. From here only they will reach. They can't go beyond that. If they want to try beyond that, they'll get a lot of pains. So these ones magnetic shoulder therapies to increase the all shoulder range of motions. Not only that, even athletes who is a volleyball player, cricketers with the shoulder injuries, Bangkok lesions, heel shark lesions, any rotator cuff injuries, all of them we can give a treatment with it. And this is a future technologies I am coming with it. This is a completely robotic physiotherapy. I am also coming up with the completely whose, for example, you can see already I have a, this is completely very high end technology. I have a some technology which is first gen. This is the future gen, and I have the first gen technology already we were using, who is with the somebody has a left paralysis. They cannot move his hand, but I have a robotic machines. If you place his hand inside the machines, that encourage exercises for the fingers, elbows, shoulders, everything. Patient support also. If patient is not supporting, patient is not cooperative also, without hurting him, without making any injury in the shoulder or any injury in the fingers, we can encourage exercises. We can do lot of things for the rehabilitation things. So that's what I told. I don't want to take much time. So we have finished. So thanks for trusting us with your care. We are honored to be a part of your journey towards your recovery and wellness. And that's my contact number sign. That is what where I am practicing. I am in Aga Khan Lane, 3rd Parklands, Doctor's Park, 3rd floor. If anyone having any doubts or any queries, please, it's open for everyone. Anything, any questions, please. And never mind it is a silly question or it is a simple question or it is a tough question. Don't mind, I'm open for everything. Please, sir. Yes, sir. Gujarati, I'm sorry, sir, but I can speak Hindi. I'm from Hyderabad. Very typical Hindi I can speak.
How about Chinese?
Oh, Chinese, no, sir. Hindi, English, and my mother tongue is Telugu. I can also speak Telugu.
I have a small question.
Please, please, sir.
A few years back, I was reading newspaper and my hand fell down.
Yes.
So I went to doctor, they did MRI. They said that there is no treatment for that. The muscles have torn. Is there any treatment for that? Because I cannot drive car now.
If you finish, sir, I can start. There is a treatment for it, sir. But the problem is they have considered your age. At the age of your age, you said, sir, 80?
84.
Yeah. Now 84, they cannot do rotator cuff repair, sir, which is very common injury in athletes who is playing football or who is playing cricket or any other. So they will repair rotator cuff, but that is most painful surgery, and rehabilitation will take minimum 3 to maximum 6 months. So at age of 84, he don't want to go through all these painful process. So that's why he said, you
Leave
take
it.
rest. Yeah, that's why,
like
sir.
that.
But otherwise,
And go with that.
yeah. But otherwise, rotator cuff repairs, we were doing so many, sir. Might be there is a heel shark lesion also inside. If I see your MRI, I can tell you, sir. But that is the main reason he said, you take rest.
Yeah, I showed to 2-3 doctors. They said it is not possible to repair it. He said, or do operation. It's not possible. It won't help you. You see.
And
Yeah.
at this age, sir, there is a higher chances of recurrency also. After repairing the surgery, for example, you take that boy, if they repair, his muscles are very strong. So if you repair it also, it is going to be attached very well in a 4 to 6 weeks time. In your age, the surgeon never knows how long it will take to heal. After healing also, if you lift a small weight, 4 to 5 kgs also, it might tear again.
But I can't reduce my age also, no?
No, that's why, sir. So that's why he said, please take a rest. Might be we never know, sir, future. Yeah, AI can do anything.
Thank you very much. I'm Dr. Moledina.
Yes, sir, please.
Practicing at Nairobi Hospital.
Yeah, yes, sir. Thank
It's,
you. Sir.
whatever I heard, it was very interesting. First thing is that will you be able to give some concession to our community?
Of course, sir. I have already informed
Okay, you informed.
Ghulam Abbas Habib, sir, already. For
Okay.
seniors, I have a very good discounts. No problem, sir.
Okay, that is one. Number two, after stroke,
Yes, sir.
what type of rehabilitation, because it is partial. Usually complete stroke is rare, but usually you have a partial stroke. So what would you advise? That is one. Number two, overweight patients. Before only we take precautions before they start having any pain or anything. Have you got any physiotherapy exercises to reduce the weight?
Yes, sir.
Okay.
So first, yes, ma'am. Can I finish with his questions, ma'am? Sorry, don't mind. So, normally, sir, heavyweight, as you said, heavyweight patient has to follow the regular protocol, sir. Now, the problem with the heavyweight patients, they cannot do exercises for the long duration, sir. So, normally, as a sports physio, I'll tell you, sir, until and unless you don't practice exercises for more than an hour and a half, then only your fat burns will, sir. Fat burning will start after 1 hour, 1.5 hour exercises. These patients, what they will do, they go to gym, they do exercise for 20-30 minutes, and when they sweat, they feel like I have done a lot. But there you are burning your calories, you are not burning your fat. Fat burning needs a continuous heat exposure. You have to expose your fat more than an hour. Then only after 45 minutes of exercises, fat burning will start, sir. Till that only calories will burn. So you do exercises for more than 1 hour, 1.5 hour. I am not asking you to go for a lifting big weights and all. You do aerobic exercises. You take minimum weight like a 2 kg weight, 3 kg weight, and you do more repetitions. In a way you do for 1 hour, 1.5 hour, gradually you reduce weights. But for that you need some nutrition consultant and all. And I have also on board nutritionist, occupational therapist. I have also a speech therapist on board, sir. Once they visit me, we can give you a nutrition advice, and also we can give a physiotherapy advice, sir. And stroke, sir, that we have to assess, sir. Stroke, as you know, sir, it is a completely paraplegic or paraparesis. If it is a plegic, rehabilitation protocol, what we use is completely different, sir. If it is a just paresis, we don't call them regularly. We teach them exercises, blah, 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 something. You do them in the home, will be fine, sir. But if it is a completely plegic patient, it is completely paralyzed, zero muscle power, nothing is there in the muscle. So then they have to come for a regular rehabilitation. And normally I'll treat every day 7 to 8 rehabilitation patients, sir. My 2 physios will work for them minimum 3 to 4 hours, sir. So that is what we are practicing, sir. I have a patients I am receiving from Congo, Rwanda, Uganda, everywhere, sir. Yes, please, ma'am.
Yes, I was finding out
Yes,
about knee pain. Do you have any therapy for knees? Because when climbing the stairs, you're even bending down, like that, even for praying, you have to sit down. And then if anything just touches it, you just feel a burning sensation. Is there any therapy for that one?
We have a therapy for that one, madam. But I should know first what is happening in your knee, which is related to meniscal, or which is related to ligament, or which is related to age-related arthritis. Yes? Okay. Which is related to age-related arthritis. You need to do one X-ray, ma'am. Then after that I'll tell you. But if you ask me, once you cross females age 50, once you cross males age 60, please avoid stairs. Because climbing up is a biggest challenge, ma'am. For example, you take your body weight as a 60 kgs or 70 kgs. Once you are keeping your leg up and you are lifting your full body, so you are going against gravity. You are going up means you are going against gravity. You are going down means you are going towards gravity. You do down, no problem, but you are going up, so against gravity you are lifting your body, which means 3 times of the body weight will go on to the your knee joint. So you are a 60 kgs or you are 70 kgs if you take, so 3 times, now 210 kgs of body weight will go on to the knee joint. So that will cause wear and tear problems. So women after 50, men after 60, you please avoid stairs. And even trekkings, hill stations, I know a lot of men, they were very interested going their grandchildren's with the trekkings, going uphill, downhill, walkings a lot, but it's not good, sir. I'm sorry, but still, once you cross 60, so wear and tear chances will be very high. So trekkings and all will affect your knees.
Sorry, it means that even like when you go for long walks.
Long walks, you will do
long
it on the
walks.
floor, no madam, there is no problem. You can do long walk, and if you ask me, instead of some surface, don't walk on cement surfaces or any hard surfaces. Try to buy a Skechers and do it on the grass. For example, now you see madam, our Joffrey's ground, you see there is a walking track. If you ask me, it's not good once you cross 60, 65 walking on the walking track. Just go on the grass surface. You first you find the grass surface is quite good or not. Is there any bumps or is there any holes? Then later on you walk on the grass surface. It helps you like a shock absorbers. The grass helps you like a shock absorber, so that there is a very less load on your ankles and knee joints. So you do walking 1 hour, 1.5 hours also, no problem, ma'am. I am only telling you uphill, downhill walking, stairs, and not only that, ma'am, squattings. Squatting is also not good once you cross 60. And floor sitting is also not good once you cross 60. Even cross leg sitting, I am not scaring anyone, I am just telling you, if you control these ones, so that there will be, you can avoid future complications. That is what only I am explaining. So cross leg sittings, like I'm a completely a typical Indian. If you ask me to, now you give me food, till date also I'll sit on the floor, I'll cross my legs and I'll eat food. So which is not at all advisable once you cross 60. So that is what I am telling. So these are all if you avoid, so that you can control your future complications. That is what I am just explaining you. Anything else, sir? Please, sir.
Good afternoon.
Good afternoon, sir.
Thank you very much for the professional medical presentation.
Thank you so much, sir.
Now I've developed a problem which could be, I would say is slight, but it is quite problem for me. Last year, when I was traveling, when I walked for about, I flew to a place, and then from there, when I walked for 5 minutes, my left calf started hurting. So I had to rest for 2 minutes. The whole journey, I had the same problem. I had to walk because I was on a tour of Spain and Morocco. So everywhere, I had to walk, and my wife, I would tell her, go in front and go, I'm coming. Okay, now I'll tell you, this thing is happening. Now, yesterday also, I was walking in DP, and I was going towards Chandarana. I had to stop at the staircase for about a minute to make it rest. I have been to physiotherapist for 3 to 4 times to massage and these things. One, I put muscle gel. I have put that, there is a cream for muscle pain by the Chinese, the small, this thing. I have taken painkillers also, because when I was in Spain, I was given some painkillers, Brufen. The chemist told me to take Brufen. It didn't work. Then I went to another chemist in Granada. She told me that this cream will work. The cream didn't work. So what could be the problem, and how can I solve it?
So now the problem is, sir, they are treating your pain, they are not treating your root cause. Until and unless they don't treat your root cause, your pain will never go, sir. You apply a painkiller, you will get a temporary relief. Afterwards, after 2 days or 3 days, you will get back your pain, sir. So first thing, you need to check your vitamin D3 levels, okay, sir, and vitamin B12 also. So when they are less, these muscle cramps will come, sir. Just whenever you have a time, if you want, I can also write it down as small prescription or something. Vitamin B12 and vitamin D3 levels you have to check, sir. The problem is, actually Kenya is bit high altitude, sir, where we are staying. So here the oxygen levels will be bit less in a climate. So that already we have a less oxygen levels, the muscle oxygen levels will be already less. So when the bone density is less and muscle density is less, no, so you will get a frequently muscle cramps. So just whenever you have a time, vitamin B12 and vitamin D3, once you check, you use that particular medicine so that you will never get back your cramps, sir. That is what your problem.
No, the surprising part is,
Yes,
it's
sir.
only left and outer calf here.
Okay.
Nothing to do with other muscles, thigh muscles, hand muscles, nothing. Only the left leg, left calf, and on the outer side.
No,
That's
it
all.
doesn't mean like a vitamin B12 or D3 levels less, your whole body will ache. So any part of the body will might pain, sir. Okay, but the thing is, if pain is coming all over your left buttock, left thigh, left calf, no, then something is coming, some nerve is compressed or something is happening in your back. But you are complaining only pain in the cuff, that too only left lateral region. So if you want, you can do one back LS spine X-ray also. But if you ask me, vitamin B3, vitamin D3, B12 and one LS spine X-ray also you do, sir. We'll get a clear picture. We can give a treatment for the completely root so that you will not get any future complications.
Sorry, when can I come and...
I have some leaflets here, sir. There is a contact number, everything, so that you can contact and you can come, sir.
Thank you.
Yeah, sir.
Excuse me. There's a question here.
Yes, sir. Yeah, sir.
I have a question here.
Yeah.
There's a menopause with the women and the weak knees.
Yes, ma'am.
Do they go along together also because of the proestrogen and estrogen levels or anything like that?
Yes, ma'am.
Okay.
Actually, once menopause has stopped, so of course the bone density will go down, ma'am. So even women will cross after 50, 55, better to take a shell call tablet or any supplement, calcium related supplements. So if you start, you can stop your
And before menopause, if you have the weakness in the knees, what could be the cause?
that we have to investigate, ma'am. So if you come, I can check and I can tell you, ma'am, if someone can come. But normally, if age is less than 50, still they have a knee pains or ankle pains, anything, we need to do some blood investigations like uric acid levels or rheumatoid levels we need to check. But if I see, I can tell clearly, ma'am.
And what about the sciatic nerves?
Sciatic nerve, which is completely nowhere related to the bone, madam, which is completely related to the back muscle. So sciatic nerve, normally when you bend forward and lifting some heavy weights, or women will bend forward and wash cloths or wash bowls. And also the problem with the women, they don't consider kids as a weights, but still kid is also a weight. So they are 15 kgs, 18 kgs or 12 kgs kids, what you people, you bend forward and you lift. As I said, now you see your grandchild is a 15 kgs, your body weight is you consider as a 60, so upper body will take 30 kgs, ma'am. So these 30 kgs and kids 15 kgs, the overall 45 into 3 will go on to your back. So almost 150 200 kgs of body weight will go on to the back, no? Of course the disc will prolapse and it will compress your nerve root. So that is what will happen, ma'am. So I am not saying you don't lift your grandchild, you sit like that, you take him on your laps, no problem, but don't bend and don't lift. Yeah, anybody else? Yeah, no problem. Yes, ma'am.
Yeah. What can you tell us about osteoporosis?
Osteoporosis means, ma'am, uh, now it's a big topic. If you have any something related to the question, pain related, I can tell. Osteoporosis means now I have to go deeper into it, and there is a lot of things to be investigated. And osteoporosis, then which part is paining, and the particular part, how I have to give a treatment. Now it's like you have asked me a completely anatomy book and in one question.
Okay, so I can visit you again.
Yeah, please,
Yes?
please, ma'am, always. There is my contact details and everything here, ma'am.
Yes.
And also I will demonstrate as simple exercises for the knee to control arthritis, simple exercise for the neck to control neck pains also. Simple things I can also demonstrate. Yeah, please ask, ma'am. We have a time.
Yeah, I have a frozen shoulder,
Yes, ma'am.
so I can't lift my hand. So,
Since how long you are suffering, ma'am?
a year.
Are you a diabetic?
No.
You are not a diabetic and you have a frozen shoulder.
Yes.
Just visit my clinic, ma'am. For sure, we have a remedy for it.
Yeah.
But only problem is, as I said, it is a chronic, ma'am. Okay, it takes some sessions, but it is treatable. Nothing to worry, ma'am. Frozen shoulders were always treatable. Once you cross 50, 60 age, normally in anatomical language we call it as a periarthritis shoulders. So it is treatable, ma'am.
Okay.
Yeah. I can also teach you some exercises if you come. First you try those exercises. Are they working or not, you see. But the problem with the frozen shoulder, when you are doing exercises, you get a lot of pain.
I can't lift more than this.
Yeah, ma'am. But still, I'll teach you some exercises. You can try them in the home.
Yeah.
If they are helping, it's okay. If not, you can give me a call, ma'am.
Thank you. Thanks.
Yeah, sure, ma'am.
Dr. Santhosh, namaste.
Namaste, sir.
So first of all, bear with me.
Sure, sir.
Santhosh means contentment, I believe. So
Santhosh means always happy. He's a
always
happy
happy.
man. Yeah, sir.
So you be happy with my one or two questions. Sir.
Of course, sir. I am here, sir. You take your time.
So my name is Somji.
Yes, sir.
I have just undergone spine surgery.
Okay, sir.
And because the pain of my sciatica was too much, my pain in the knee was not very pronounced.
Okay, sir.
Now when I've been told to walk. Now when I walk, I've already had 2 operations on my knee for the meniscus. So the knee swells and pains. However, I have to reduce my tummy because my elder here, he always tells me that the tummy is big. So now what is the exercise or how do all these things happen? Number one, I have to sort out my knee, for which I will visit you.
Sure, sir.
Now, people like us who are over 60s, how do we have this habit of walking more and more and more? Because you are saying if you don't walk for 1.5 hours, it will not work.
No, I
burning, the
told
fat will
1.5
not go.
hour for a fat man,
Yeah,
not
no.
for you, sir.
Oh, thank you so much. That's a compliment.
Yeah, sir. No, he's not so fat.
Thank you.
Don't worry.
So how do you now, do you think biking, cycling, static, not in the street, will help?
Sir, so that is what, sir. Exercises are always 2 types, sir. One is aerobic, one is an anaerobic. Anaerobic who needs a big muscle. Like you can see WWE or somewhere like a professional gymmers, they want a big muscle to show. They go for an anaerobic exercises. Like we have to go for a aerobic exercises, sir. Like if you have a cycle has some intensity mode, you can also add some kgs and all. Don't add too much, 1 or 2 kgs you can go. And you people do exercises for 30-40 minutes is more than enough, sir. Is that walking is also, you go for 30-40 minutes is okay. And I have not seen any fat or any over tummies are here. You people are still good, very nice. No. So 30 to 40 minutes exercises is very good, sir, at this age. So you do 30 minutes walking in the morning and you do 30 minutes walking in the evening will be more than good. But if you don't have a time for the morning and evening, Once only you can do, then you do 40 minutes. So that is what I will suggest for you, sir. And now it comes to your spine surgery, you are asking, so what type of exercises I have to teach you depending on your surgery, sir. Some surgeons will do endoscopic discectomies, which is a keyhole surgery. They go in and they will trim the disc and they will come out. Some surgeons, they fix with the plates and screws. So my rehabilitation is also differ from which is fixed with the plate or screw, or is it only endoscopic trim, disc trim. So I need to see your X-ray, then I will prescribe you what to be done.
See my MRI?
MRI, that is before surgery. No one will do after surgery. So after surgery I want to know. Otherwise if you come with your discharge summary, also I can prescribe you what to be done, sir. Spine is a very sensible area. You cannot rehabilitate however you want. Even I'm not blaming anyone, but I'll tell you one thing, sir. If you go outside, back pain, everyone is treating in a same way, sir. Back pain has almost more than 100 different type of differential diagnosis. For example, spondylosis means the upper vertebra will compress the down. So that rehabilitation, that exercises will be different. Spondylolisthesis means forward displacement. So the upper body vertebra will move forward. So for that also they are giving you same exercises. In that, flexion is not advisable, but still they are teaching you flexion exercises because they don't know what is happening in your back. And retrolisthesis. Retrolisthesis means backward displacement of vertebra. So like this, there are n number of differential diagnoses in back pain. But unfortunately, physios or people are treating in a same way, single way. So it will not work. I will not blame anyone, madam. I am not here for blaming anyone, but I am telling you, so differential diagnosis and the exercises also differ from your problem, and your diagnosis also has to be clean. Can you read this one?
When I walk, one of my knee will move, and just a second, then it's back to normal. I think the kneecap, moving of the kneecap.
Okay. This one, when I walk, one of my knee move, and when I just stand, it will come back to normal. So there are the two difference, madam. So you might having some ligament injury that I need to assess your physically, because there are the 4 ligaments which plays a major role in our knee to be stable. One is ACL, one is PCL, one is LCL, one is MCL. So which one of a ligament will cut? So there is no stability in the knee. So when you are walking fast, it will move front, and once you stop, then it will come back. So I have to assess physically, then only I can tell you. So next question.
Let's take these two, and then we do the demo.
Yeah, no problem. Yeah.
This one is
Then what we do, we'll take him bit here so that even females can see. For both of them, we can do it once. Yeah.
Is there any treatment for urethral dialysis?
No, madam. This one, I cannot give any treatment when you are undergoing dialysis. But you have a uncontrolled bowel and bladder, you are not able to controlling your urine, you are not able to control your motion, long calls, short calls, we have a treatment. But dialysis, that is completely out of my subject, which has to be taken care by a nephrologist or urologist. So that's not my.
So is an X-ray only prescribed by a doctor? Do you have X-ray facilities in your center?
So it does. I am also a consultant. I am also authorized to write a prescription or any investigations. I am also authorized to diagnose. I am not authorized to operate. I am just a physio. I know my limits. But still I can prescribe you X-ray. But I don't have any X-ray in my clinic. But if you come to my clinic, same building. Dr. Sparks is a doctor's building completely. If you enter there, you will find all type of doctors. So in the same building, we have an X-ray facility. If you come there, if I prescribe X-ray, you can go and you can get it down and you can come back, ma'am. It's in the same building. Still anything? Yes, sir.
If I put in such a way that from
Yeah,
PowerPoint
sure,
you can
sir.
see. So
Please come,
anybody
sir.
behind,
Yes, ma'am.
isn't it? No, I'm just
Yeah, she's calling you.
yeah, yeah. Okay.
Please come, sir.
And the PowerPoint ma dekha, so everybody can see.
Can you lock? Yes, please tell me, sir. First, what is your problem?
Bas bhai,
You did already.
khob re. PowerPoint
You haven't
niche
had.
jai to they can see.
Can you sit down, sir? Can you hang your? Yes,
Yeah.
yes, please.
Camera and board, yeah.
One you remove so that everyone can see.
No. Yeah.
Now, sir is suffering with an arthritis, madam. Even I am just showing you a simple diagnosis, you have arthritis or not. This is 90% accuracy, not 100%. 100% is always an X-ray. So, but still, now you see anyone can keep hands on his knee, ask him, lift your leg, sir. You can see, sir, fold, bend again, fold. Now you keep your hand here, lift, fold again. You can hear the clack sounds. That is what arthritis. Now you keep your hand on the knee. Now you just do. Okay? Young man, you come here. Just sit. Now you keep your same hand on his knee, sir. You can just keep. Now you lift your leg. Fold. Lift. Now you can see how clear it is. Now you see your knee. So that is what arthritis. So that is the simplest diagnosis. Before there was no X-ray, there was no MRI. This way doctors used to diagnose the patients. So this is a simplest way to find out you have an arthritis or not. So he has an arthritis. And you can lie down, sir. And this is actually a bit more, sir. This is a severe arthritis, advanced arthritis. Okay, this needs a knee replacement for sure. But the thing is, I'll teach you some exercises to maintain your muscle power. So this one, what exercise I'm showing him right now, sir, once you cross 50, 60, please everyone can do, so that you can strengthen your knee. And these exercises everyone can do. It doesn't have any secondary complications. I'll show a simple static exercises. For all knee pains we can do. All knee pains, any type of knee pain. See, for example, some exercises you can do, some exercises you can't do. And some diagnosis, this is advisable, some diagnosis is this is not advisable. It's like that. But arthritis or any other knee problems also, which exercise I'm showing now, everyone can do, so that you can maintain your knee stability, knee strength. So let me stand this side so that for you people it is easy. See? So don't mind, sir, give me pillow. So now lie down. Can you go up, sir, bit? That's okay, sir.
Doctor, can I move him a little bit this way just so that...
No problem. It's okay? Please lock it. It's okay, sir, or not yet? It's okay. No, that's okay, leave it, sir. Normally we use some balls or something, but here whatever I have, I am using them, so that even in home also you can do in a same way. No need to buy balls or anything. Okay, you can take a pillow, ma'am. Okay, what you can do, even if you don't mind, sir, can I show your knees to them? If you don't mind only. Can you stand up, sir, once? I'll show them, they'll get an idea what is arthritis also. Now, can you lift up your knees? Show. You can see his knees also, everyone. You see, arthritis is also two types. One is a varus arthritis, varus related, and one more is valgus. Valgus means bow legs. The knees will go deform in this way, that is more common in females. The knees will go this way. Second type of arthritis is varus deformity. You can see like this. Now you can see, sirs, which is varus. the knee is going outside. So that is a varus knee arthritis. So this is most common arthritis once you cross 60. Okay? Yeah, please come down. Thank you, sir. Okay. Now, you take a pillow, place it under your knee. So I'll show it in your right leg, sir. You can do same exercise in your left side also. Okay? Place it under your knee, press down your knee, hold for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. So that is one set. Okay? Again press down. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. That is second set. Like this, you do morning 10 sets and evening 10 sets. Because of these exercises, you might get some pain in your thigh. Okay? If the pain is too much, you do start with the 5 sets. But you are not feeling much pain, you are comfortable, then you can start with the 10 sets. So that is first exercise. Okay? Now the second exercise, can you go up a bit, sir? Only small? That's okay, sir. Now the same pillow, you place it under your heel. Before, when you are pressing, your quadriceps muscle will work. Now you have to keep your leg straight. Now press your heel down, sir. Only heel. You are not pressing here. You have to press your heel. Here, when you are pressing your heel, your hamstring muscles will act. Okay? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. Again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. So this is also same. 10 sets in the morning, 10 sets in the evening. Okay? This is second exercise, sir. Now the third exercise, same pillow, you fold, place between the knees. This is for your abductors. Okay? And adductors also will act. Press towards. Okay? Hold for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. Again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. So this is the third exercise. This is also, if no pains, you can start with the 10 sets in the morning, 10 in the evening. If you have some pain, we can always start with the 5 sets. So that is third exercise, sir. Now the fourth one, you should lift your leg straight. And you have to lift until only 30 to 40 degrees maximum, sir. Then only your quads will work. If you are going like this completely, then your abdominal muscles will work. So then it will be useless. You have to lift until here only. Again you wait for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Down. Okay? Again, sir. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Down. So this is the fourth exercise. Okay? Now sit down, sir. Sit down and drop your legs down. And the fifth exercise for the arthritis, can you go back a bit? Okay, that's okay, sir. Now lift this leg up. Hold there for 10 seconds again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. Again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. So these 5 exercises will help for arthritis. You do morning 10 sets, evening 10 sets. Even after knee replacement also, you really not require any home care everyday physiotherapy. You do same exercise morning and evening, you will recover, sir. The same exercises. Nothing much. Nothing to add also. So these 5 exercises, hope you remember. Yes, ma'am.
Problem.
Yes, ma'am.
Would that exercise help?
No, ma'am.
No.
Heel problem, first we have to know it is a calcaneal spur or plantar fasciitis. But still I can show some stretches who have, if patient is here. Is it a plantar fasciitis or calcaneal spur? I should diagnose first.
I think that plantar
fasciitis.
Yeah.
But still I can show some stretches. Any patient is?
Switcher. So he shows
Come,
us the exercise.
you are a young man.
Yeah,
Come.
So he shows us exercise.
Just lie down. I'll show them some simple stretches. So always plantar fasciitis are who is having a heel pain. So what you do, give me pillow. You go up, let them show clearly. So let me keep the pillow here. No need to keep a pillow, ma'am. At least people should show clearly. That's why I'm keep placing a pillow here. So in the morning only, normally calcaneal spur or plantar fasciitis, early morning when they get up, when they are keeping their foot down, it will be too much painful. So once you get up, first you do these stretches. Okay, what you do, you take two words, your foot completely, maximum, and hold there for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, relax. Again. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, relax. So this is the first, you have to take towards your side, maximum you have to give a force, okay. Now the second one, you go down completely. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, relax. Again, go down. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, relax. This is the second one. The third one, you have to rotate your foot clockwise 10 times and anti-clockwise 10 times. Which means you are just increasing your circulation to the area so that you will not get any pain. Just clockwise 10 rotations. Then yes, anti-clockwise. Then go this way. No, it doesn't matter. So you are young, you are doing bit fast, but others I cannot expect in the same way. So this one, these four you have to do, and there is a one more technique, we call it as a Bobath approach. Who has a severe heel pain or calcaneal spur, what you do, you have to take a you need to take a 2 buckets, or mugs is doesn't matter, okay. For example, I have a right heel pain, okay. You take a 1 hot bucket, water of hot bucket, one is a water of cool bucket, okay. So your foot should go, or your leg should go until here. It should not go completely until here, only until here is okay. This one you have to practice also twice a day. You start with always hot water, always end with the hot water. For example, you are starting now, you keep your leg in the hot water, you wait for 15 to 20 seconds, not more than that. Then immediately you lift, you keep in your cool water. It means you are increasing the circulation, nothing much. So once the always, ma'am, pain means, there is a pain gate theory which is a big subject, but the thing is, pain gate theory means, it's in a layman's language, I'm just explaining, your circulation has stopped. So when you are doing hot, cool, then we are helping to increase your circulation. So then you are keeping in a cold water for again 15 to 20 seconds, or 30 seconds you take. 30 seconds hot water, 30 seconds cool. Again you keep it in a hot water for 30 seconds. You repeat for 5 to 10 minutes, but always start with the hot water. Please end with the hot water. Don't start with the cool, because cool freezes. So it will not allow you to it will not allow to increase the circulation. So start with the hot water, end with the hot water. After doing this in the night, then you don't walk, just dry it and sleep. And next day morning you do those stretches what I taught you. Now you see, just in a week time you will be fine. Hope. Please, sir. Sir?
Excuse me.
Ma'am.
When you have something like the calves are very tight.
Yes.
Yeah?
Yes, ma'am.
So, like some would say, the blood circulation is not okay, and you wear those stockings of surgicals and something like that. So, I don't know how, what happens, why does this? Another question from the ladies is that if you have like swellings on your, on your
feet.
on your feet or on your ankles. So what's the cause of that also?
No, madam. Normally, feet or any other part of the body, if you are not moving for a 4 to 5 hours, even you see when we are traveling in a flight, we sit.
Yeah.
Okay. After 6 to 7 hours, the swells.
Yeah.
That is normal. But the thing is, frequently swelling is coming. Then that is something else.
Okay.
You need to meet a physician. It might be related to kidneys, or it might be related to something else. So When it is coming only on traveling, nothing to worry. But if without traveling also it is coming in a day and night, always it is coming, please visit a physician. Yeah, ma'am. And the cuff, I can show you some stretches, ma'am. Okay, you need to do a stretches. And cuff muscle tightness is, it's not good. Okay, that might cause a DVT, deep vein thrombosis. So we have to do stretches for the cuff so that it will be fine. Nothing to worry, ma'am. So you are saying something?
Some exercises for the memory loss. You know, as we are advancing.
Memory loss exercise.
Memory loss, yeah. You know, on a lighter tone, it has happened not in our country, but somewhere where I had gone for a conference. Both the cars were parked together and almost similar. So after the function, the lady entered the other car, which was not hers, and they drove. And then she realized that this is the wrong car. You know, it can happen, and memory loss is quite common as we are aging. So you have something?
But I am really sorry, sir. I don't know even for memory loss any exercises, but still. Okay, not a neurosurgeon. You need to visit a psychologist.
No, you have written that neuro stimulator, so that would not.
So nerve stimulators for a nerve injury, sir. Nerve stimulator will help in a foot drop, wrist drop, brachial plexus injuries, urinary incontinency. Everywhere it will help, sir. But I am not a neurosurgeon, sir. So that it's a very tough. Last two. Oh, it's okay.
So first one is recommendation, cold packs or hot packs?
No, recommendation is cold pack, hot pack. It's a tough question. The thing is, always acute phase, please use cold packs. Acute phase means immediate after injury. For example, being a sports physio, I use a cold pack whenever athlete has fallen down on the ground. So that is an acute phase. So there is a lot of circulation, there will be a higher chances of inflammation comes. As I just explained, if you want to stop the circulation, you need an ice thing. So in acute phase, we have to use always cold. In a chronic phase, like now you have a back pain, you are suffering since long. So there you use hot pack to increase the circulation. So acute phase is always cool and chronic phase is always hot. Yes.
There's still swelling and pain.
Is the patient is here, sir, this one? We have to even see. See, there is a question, 3 years of knee replacement, still swelling and painful, which means I need to see the patient first. See, there is an implant inside, there is a lot of complications, that is an external body which we replaced inside. So, swelling will not come simply. If implant is loose, swelling may come. If there is any infection or something else, swelling may come. So there is a lot of differential diagnosis. I need to see him first, then only I can tell. If I see, I am sure I can tell. Ma'am? No, that's what, ma'am. If acute phase you use cool. But it is a chronic phase, even somebody has an inflammation since long, might be 3 days, 4 days, still you use hot. But if it is an acute phase only, you use cold. Yeah. Please, sir. She wants to.
Doctor, on a lighter note,
please,
looks like you have got about 12 to 15 patients from here. And Abbas was telling me that, first time we come to you, it's on complimentary basis.
No worries, sir. Please visit. Consultation is always free.
Individual notes. I think you can maybe do a brief conclusion and then we can get
Yeah.
You want to talk anything?
No problem. Yeah.
You want to close, huh?
So, hope everyone understood everything. I hope I have cleared everything so that I just wanted to close it now. Oh, please, ma'am. Okay. If you do exercises. No, that is what I am just explaining, ma'am. No, that is what I am just explaining, ma'am. Problem with the back exercise, it is neck or it is back, they will trigger the pain. So that's why what we do normally, we concentrate on the pain. The day patient feels a bit better, 50%, 60% pain relief, then we start teaching them exercises. That is what the protocol we follow. In your condition, always cervical region will be contacted to the brain, cerebellum. So we called it as a cervical spondylosis is always cause dizziness and also cause vertigo and all. So nothing to worry, madam. I am also expert in vertigo exercises and cervical spondylosis. So this what I can teach you exercises, nothing to worry. Yeah, yeah. Yes, ma'am. No, that you need an ergonomics lecture now. So I need to come with a big, some more different PDF. I need to teach a completely ergonomics now. That is what spondylosis and forward neck postures, everything, ma'am. So anything? Yeah, okay, sir. Please. Thank you. Thank you so much. Okay? Thank you, ma'am. Thank you, sir. Thank you. Thank you.
After you talk for ambassador, thanks and everything.
No, oh, Thanksgiving we can start? Oh, okay, no problem. So, just give me a minute, sorry. Now, I just wanted to, a special thanks to an ambassador of Iran, Sir Ali Gaulampur, sir. So, thank you so much and thanks for your time, sir. Thank you, thank you, thank you so much, sir. And thanks to SAAJ community, seniors community chairman, sir, Ghulam Abbas Habib, sir. Without you, this would have not happened today. Thank you so much, sir. Thank you. And thanks to SAAJ seniors. Thank you so much. Thanks. Okay, sir.
Thank you once again. Thank you to all of you for attending and interacting. Thank you again to the Iranian ambassador, Dr. Ali, and also to the representative from the Cultural Council, Dr. Ali as well. Thank you all for coming. Thank you to everyone. And the final and the biggest thank you to Dr. Santhosh Kumar for taking us through this session and educating us more about exercise and the importance of keep moving in our lives. So with that, as a very small and kind gesture to Dr. Santhosh, we'd like to present him with a small plaque for taking us through the session today. Thank you so much. I'd like to call Dr. Ali, the Iranian ambassador, to present the plaque to Dr. Santhosh. Please can everyone come forward, inshallah, for cake cutting in honor of the Holy Prophet sallallahu alaihi wa sallam. Allahumma salli ala Muhammad wa ali Muhammad wa ajjal farajah. You You need the stand?
Better. Bus. All right. No, I'm good. So this is in honor of our Prophet, Dr. Santhosh. This is in honor of our Prophet, Hazrat Muhammad sallallahu alaihi wasallam. میں اس طرح سے ہوں یا رب تیری ثنا کے بغیر، میں اس طرح سے ہوں یا رب تیری ثنا کے بغیر، کہ جیسے جی نہیں سکتا کوئی ہوا کے بغیر، نہ مجھ سے حمد کا ایک لفظ بھی رقم ہوتا، نہ مجھ سے حمد کا ایک لفظ بھی رقم ہوتا، خدائے آل محمد تیری عطا کے بغیر، نہ میری حمد مکمل ہے مصطفیٰ کے بغیر، نہ میری حمد مکمل ہے مصطفیٰ کے بغیر، نہ میری نعت مکمل ہے مرتضیٰ کے بغیر، نہ میری نعت مکمل ہے مرتضیٰ کے بغیر، میں اس طرح سے ہوں یا رب تیری ثنا کے بغیر۔ افضل السلام